In less than a month, Dr. Charles Chima, the new public health director for the City of Sioux Falls, will have his first day on the job. It's a role that has been in the spotlight since COVID-19 became part of our lives. And in tonight's Eye on KELOLAND, we take a closer look at how the new public health director views public health. Born in Nigeria, Dr. Charles Chima is a medical doctor who also holds a Master of Science in Epidemiology as well as a Doctor of Public Health.
There's something that you cannot purchase anywhere, which is the experience of having lived and trained in 3 different continents. You just have a different worldview.
He's been a part of public health and healthcare in 3 different continents, right? And he's seen healthcare delivery in a variety of different settings. And as our community continues to evolve and change in how we're delivering care and the diversity of our market and so forth, I think Charles is going to bring an incredible perspective that I know I don't have, and I know many in the city maybe don't have.
And now they do.
I felt that strong desire to go back to the front lines of public health work. And while Sioux Falls, the simple answer to that is that Sioux Falls loved me first.
I'm really honored that he applied and wanted to come to Sioux Falls, South Dakota.
Mayor Paul Tenhaken and Chima say COVID-19 has changed how people view public health.
Our antennas are raised much more in this community around the importance of public health. And
I think COVID has brought in a sort of a heightened awareness about public health. But there's still a lot of challenges we need to solve around trust.
Getting the right person in this chair, knowing that we're only one virus away from another pandemic, and having someone with an epidemiology background and a clinical background and a leadership background, I think is very, very important.
The clear expert consensus is that COVID-19 vaccines are safe. Not everyone, however, is convinced.
What do you say to them, to someone who might not trust the science behind COVID-19 vaccinations?
So I'll start by first acknowledging where they're coming from.
Education can bridge gaps.
We need to do more on building awareness, both in terms of the vaccine and the science around it.
And who the messenger is can make a difference.
They may not listen to the doctor or to the expert, but they will take advice from someone they went to high school with, or someone they just know from Facebook or something, right? And they will go with that, right? Because they trust that person in every circumstance of life.
How the message arrives matters too.
They're not just rely on the experts to tell people, oh, go take the vaccine, it's right for you. It's more, no, I'm telling you that there's nothing to be worried about. I've taken it, you too can get it. So we have to identify champions to work with in the community too.
For Chima, leadership and service are tied.
He who wants to be the leader has to learn to be the servant. And that's how I approach leadership, is you have to come to leadership with a real desire to serve people.
And Chima's first day is Monday, June 14th.